Welcome back, everyone, to the final day of Virtual Wish 2020. It has been a very busy week of debate, but it is not over yet. More discussions and interactive sessions are coming up today in the run-up to the closing ceremony. And the next one of those looks at the interface between health and education, how activities and messaging to promote good health can be better implemented into the systems in which our children learn.
And highlight the important role that schools play in child and adolescent health. It's been really acutely brought in focus with the school closures we've seen during the COVID-19 pandemic. We're going to look over the course of the next hour or so at some of the opportunities that schools offer for improving child and adolescent health in the short and in the long term as well, and look at maybe some of the things that have prevented it from working well in the past. Here's a question to start us all off today. Can we put in place a framework for effective integration of health and health promotion activities into education? All of those things are actually covered in the Forum report, which was written and published for WISH under the leadership of Professor Russell Viner, who is one of our panelists today. And we really want this to be a highly interactive session. So in order for that to work well, we'd love you to send in your questions. We'd love to have plenty of time as well to go through some of those before we close in just over an hour's time. So let me introduce to you who we have speaking with us today and who's on our WISH panel. We have Her Excellency, Sheikha Hind bint Hamad Al Thani of Qatar. Thank you for being with us, the Vice Chair and CEO of the Qatar Foundation. We also have Her Royal Highness the Countess of Wessex joining us from the UK. Thank you for being with us. I mentioned Professor Viner, who is the Professor in Adolescent Health from University College of London. We have Dr. Matshidiso Moeti, Regional Director of Africa for the World Health Organization. Oh, thank you for the wave as well. Very nice to see you. And also Justin Van Fleet, who is the President of Their World. And we'll find out a little bit more about exactly what Their World is later on over the course of the next few minutes. So before we speak to our panelists, do send in your questions. I know probably it's some burning issues you have already, but let's set up our discussion from by watching this film from Professor Viner.
Hello, my name is Russell Viner. I'm honoured to be presenting the report on building healthy societies by integrating health and health promotion into education. I want to start by thanking the members of our brilliant working group, particularly Didi Thompson, Nicola Davies, and of course Ara Darzi. Children and young people are 25% of the global population, but they're 100% of the future, of all of our futures across every culture. The great task of childhood for children themselves and for nations is for children to grow up into knowledgeable, productive, healthy, and happy adults. Both education and health are key to achieve this, and they are inextricably linked in ways that we need to much better understand. Education is one of the most powerful social determinants of health, as Michael Marmot told us in the WHO Commission on the Social Determinants of Health. The better educated live longer lives, they're more productive, and they're happier throughout those longer lives. And this is true in every country. The COVID-19 pandemic has been an extraordinary example of the links between education and health. And it's very sad in many senses that it has taken COVID to teach us this. Children were very little affected directly by COVID infection, but the closure of schools in nearly every country quite early in the pandemic has dramatically affected the health, mental health in particular, and life chances of the next generation for almost every country. At the height of the pandemic, over 1.5 billion children were out of school, and the health impacts of this has been and will be extensive. COVID-19 has taught us just how closely linked health and education really are. Yet very few countries have an integrated vision across education and health. In most countries, the Ministry of Education is the lead department for children. It holds the money and the power. Health tends to focus mostly on adults, of course, on mothers, but also on children, very much only on those before school, the under fives. This must change. We have identified 3 dimensions in which health and health promotion must be better integrated with education. First, schools should be engines of health. We must redesign our schools to inevitably and naturally produce healthier young people. We must redesign our schools not just to educate, but to promote health. And there's randomized controlled trial evidence that we can do this. Secondly, schools give us opportunity to target those most at risk and intervene. And thirdly, schools are a platform for the delivery of health and health-related services, such as vaccines, such as nutrition, deworming, a whole range of things. There are many barriers to the better integration of health and education, and our report focuses on key levers for countries and actions that are needed to overcome these barriers. The first lever should be around consensus on the goal of education and broadening that out to be around health and well-being as much as about simple attainments. We need buy-in from sector and departmental leadership, and we need changes in the training program across education and health. And most particular, we need cross-sectoral collaboration and understanding across departments, across civil servants, but across governments. Our report is a call to action for countries and the international community to improve the future of our children and young people through better integration of health and education. We outline a series of key actions that are important, they're simple, and they will be effective, but they are much needed. Improving the health and well-being of children and young people is a paramount need for all of us now. It will bring us a triple dividend for the children of today, for the adults they will become, and for the parents, which they will be, of the next generation. Thank you.
Oh, Professor Viner, thank you very much for that. And that set us up very nicely for our discussion today. And just a reminder once again for all of you who are watching in various corners of the world, please do send in your questions for our esteemed panelists. And if I could just ask a question to everybody who's with us today so far and get the early thoughts of everybody. Your Excellency, if we could come to you first of all. We've heard there from Professor Viner, who's really sort of laid the groundwork for what we want to talk about today. And we know that there's evidence of better health, as he was saying, linked to improved school performance. But despite all that, health is rarely, isn't it, an education goal? Why do you think that is the case in so many countries?
Good afternoon. Thank you very much. So I think that when we think of mental health, it is a critical subject that is really missing in our education system. But I don't think adding it to the school assignments or looking at it as a metric to improve school performance is really going to solve the issue. We really need to take a step back and look at health as an integral component to living a fulfilled life. So if we think about how could we do that, I mean, it needs to be part of a holistic learning environment that we create for our children. If we look at the issue more holistically, the first step becomes identifying how schools themselves are contributing to the mental health crisis. What is the effect of regular exams on children? Competitive sports, bullying. Let's take an honest look at how we can, as institutions, help relieve that stress. If we're going to tackle student well-being, we need to be serious about creating a less anxious future. But however, the question does remain, how do we teach students the know-how of well-being? And I think that's one of the most critical things. And as a parent myself, it's something that I struggle with teaching my own children. Should all young people be taught about their bodies and their brains as part of the basic educational curriculum? What are the physiological prerequisites that make mental well-being even possible? Half of the solution, I believe, lies in asking the right questions. And so how do we do that? As part of the suggestions from the report, what I found intriguing was really the issue of the mental health language. And teaching children the right vocabulary to express themselves is something that I think is most often overlooked. So how could we give children the right language to understand their feeling, to be able to express their feelings? And clarity, of course, is power. So when we talk about physiology through abstract language, we have abstract conversations. As adults ourselves, we find it difficult sometimes to even understand that. So how can we break it down for children? So I think the most important thing, in my opinion, really is to know, how do we empower children? And to empower a child is to give them the adequate tools that can cater to their unique needs, and allowing them to grow in a safe, healthy, and nurturing environment. So I look forward to hearing more about this discussion on the report, but it really is something that I don't think any of us have completely gotten right, and it really has shown that the education system has to be re-looked at to understand how to nurture a child holistically.
Okay, that's really helpful. Thank you so much for setting us off on that road. And I'd love to come to Your Royal Highness, if that's okay, because I know one of your particular areas of interest is the prevention of blindness, which I know many people watching this will be aware of. But can you tell us a bit more about your role as a global ambassador for the International Agency for the Prevention of Blindness, and maybe give us an insight into what you've learned from that role?
Thank you, Dan. And to all my friends in Qatar, assalamu alaikum. It's really good to be joining you, albeit virtually. But inshallah, we'll be able to meet again sometime soon. But it's a wonderful opportunity for me to be able to address the Wish Summit today. So as Dan has just said, but I've been patron of Vision 2020, the Right to Sight, since 2003, and Global Ambassador of the IAPB since 2011. In that time, I've travelled to a number of countries around the world and seen for myself the effect that early intervention can have on preventing young eyes from losing sight. In the past 2 decades, through the work of many international eye agencies, and more recently with the incredible support of the Queen Elizabeth Diamond Jubilee Trust and Qatar Creating Vision, we've managed to make enormous progress in ensuring that children have the opportunity to learn about the importance of eye care and in detecting problems at a premature stage, which of course can then be successfully treated or managed. In so many developing countries of the world, there's been historically a culture of acceptance that if you have an eye problem, it's pure luck of the draw, and that what will be will be. However, what we know is that if we're able to reverse that understanding through creating better awareness of treatments, promoting the positives of wearing glasses so we reduce stigma, and also ensuring affordable, available eye services, the effects can be absolutely profound. Teachers and schools are absolutely critical when it comes to these kinds of messages and interventions. And I've witnessed classrooms of children in Malawi learning about the importance of hand and face washing to help preventing blinding trachoma, for instance. I've seen teachers using simple technology to identify basic refractive issues that mean a child can be offered glasses so that they don't disappear into the shadows of the background of the classroom because they can't see the blackboard, and eventually dropping out of school, which thus reduces their life chances. In Bangladesh, I've met children who will now not lose out on an education having had cataracts removed and being able to be prescribed glasses. In only 4 years since its inception, Qatar Creating Vision has become a lifeline to millions of children across India and Bangladesh. And working together in partnership with Orbis, QVC has delivered over 82,000 training sessions to doctors, nurses, and crucially teachers and community health workers. All of them are now better equipped to identify early problems. The collaboration between health and education, hospitals and schools has led to 6.6 million screenings and treatments. At the same time, the engagement of children in helping to educate each other about the importance of eye care is beginning to turn the tide in understanding that eye issues can be treated, that glasses are good, and that eyes are precious and important tools that facilitate study and potential work opportunities, and that poor eyesight or diseased eyes should not be ignored or accepted as fate. We all know that education is not only a right for every child throughout the world, but that it lifts whole communities. And the young vision ambassadors in India, made up of school children, are helping to run screening days, therefore assisting their counterparts to learn. This approach is playing an enormous role in changing attitudes, and these messages are also helping other family members access help if they have eye conditions too. What we know is children are powerful advocates, both within their peer groups, but within their family networks too. What we need, of course, is for governments to understand that education and health, when they work together, are a winning combination. I have seen how combined efforts have the ability to turn the fortunes of citizens around. The evidence is before us that an integrated education and health service approach is the most effective way to tackle blinding diseases and bring vision to the masses. So in answer to your question, Dan, what have I learnt? I've learnt that eye care is vital to the furtherance of education, which leads to jobs. Eye care programs are low cost and highly efficient, that the treatments are all there and can transform lives if people can access them, and that together government departments, health workers, eye agencies, schools and children can work alongside each other to achieve great things. And that's what I call lessons very well learned. Thank you so much.
Thank you so much, Your Royal Highness, as well. And if I can just pick up on some of the points you've mentioned there and take that to Dr. Moeti as well, because Dr. Moeti, thank you for being with us on the panel today. I know you have extensive experience of your job as Regional Director of Africa with the WHO, and also you've worked in the Botswana Ministry of Health. So picking up on what Her Royal Highness was saying there about the importance of health being integrated into education, what sort of policies do you think are necessary? What have you seen that works in terms of getting that to happen?
Okay, thank you very much. First, thank you for the invitation to join the WISH, even if it's virtually. I was at the last WISH in person, so it's a great joy to be back with you again. Indeed, I think it was already said that the evidence is incontrovertible that health, education, productivity, income levels are inextricably linked, and there's synergy in terms of outcomes with healthy children and adolescents having better school attendance, performance, and prospects for their futures. So all this to work, and I was very interested in hearing Her Royal Highness's examples about eye health, in which I've worked in African countries as well. There is a need for policies that enable and that support this first awareness and then the actions around the integration of education and health in the most effective way, so that you can have outcomes that are positive in education and outcomes that are positive in health as well. And these policies are needed to be developed, first of all, at the national level. We talk a lot in WHO about health in all policies. And this was an outcome of that commission led by Professor Mahmoud that was referred to earlier on, so that there is a conscious effort to make the policy links, the policy decisions that will enable then the actions that are needed in this integration at the level of the ministries of health, ministries of education, other ministries that need to play a part, for example, in creating a healthy environment, such as those dealing with water and sanitation, for example, in African countries, and most importantly, the financing of all of this. So it needs, first of all, to be a development policy decision of the country and the government, recognizing this synergistic links and making sure that those ministries that are important in enabling this to happen take the decisions and then make them be implemented through their own systems in ways that continue to be linked. We believe that this integration needs to be pursued holistically, starting with making sure that health content is part of the school health curricula, formally, in a way that's compulsory, in a way that's going to be examined so that it is taken seriously by teachers, by children, by parents, etc. And then I also think it's important that the policies address the health risks of children at different stages and take the opportunities for delivering as well critical health interventions and services to children. So children need to know about health, be taught about health, have the knowledge. And because I think it's already been said, they can be such an influence, not only on their friends, but also on their families and their communities. If I take the example of my two daughters when they were young, my 7-year-old came home one day and said, "Mommy, I'm no longer going to eat pork. It gives you worms." Her 4-year-old sister said, "Yes, me neither." And believe me, I've never looked at pork in a supermarket since. I know that I can buy pork, which is safe, but they simply refused to eat it, got me out of the habit of buying it, and that was a permanent influence on my life. Children can have huge positive impact on their families, and I think this is very important in our African settings, for example. And then the life skills around adopting behaviors that give children agency, that needs to be part of the policy and the strategy of integrating health. If I take the African context, again, we have very high levels of teenage pregnancies. In Africa, we've had an HIV pandemic where young girls were particularly vulnerable. And it was important to enable children, adolescents, to understand the risks for themselves and to get the skills to be able to navigate safety for themselves. That's relevant also for other problems around drug use, around the use of alcohol, healthy lifestyles, healthy eating. So that combination of education, information, and skills to implement what they have learned, including very importantly understanding themselves around mental health, are extremely important. Policies need to support that at the level of communities, decision makers, influencers, opinion shapers. So we need to engage the parliaments, need to engage different communities so that what is being done in schools can be very supportive. For example, we saw in African countries when it was time to benefit from the human papillomavirus or HPV vaccine, which is important for preventing cervical cancer, which is the #1 cancer that's killing African children. There was a very strong pushback from parents who were concerned about the sexuality links of this. What is this doing to our children? Is it making them infertile? Why is it linked to sexual education? So there needs to be understanding within the policies and promoting understanding in the communities to provide a supportive environment. And if I can just end with the COVID-19 pandemic, which indeed has taught us a lot, it's important for school environments to be resilient in many ways, including to preventing outbreaks in African context, water and sanitation, and outbreaks of diseases like cholera. We are learning now that we need to look at additional elements to be able to sustain providing education to children despite health risks like a pandemic of COVID-19. That needs to be part of the design of the education system in schools, including now we're learning, being able to do distance learning when it's necessary, but of course being able to provide a safe environment for learning as far as these outbreaks are concerned. There are many examples of some of this happening in countries in the region that I know best. What is needed now is to have a more holistic approach so that these are approaches that can be scaled up countrywide. It would make a huge difference to children. Thank you.
Thank you, Dr. Moiety. I love the way you've broadened out the discussion as to whether we should eat pork as well. It's very, very interesting to hear the wisdom of your children on that one. Let me bring in Mr. Van Fleet as well, Justin Van Fleet, who's the president of Their World, who I know has been listening in very carefully to what's been said so far. And we know that you are, an advocate of quality education, and obviously that sits well with your position looking after a global children's charity. But if we look at some of those figures, average expenditure per student is quite a startling stat. In primary education, is more than 40 times larger in high-income countries than it is in low-income countries. Give us an idea, if you could, Justin, of the impact that expenditure has on children's health in education around the world.
Great, Dan. Thank you so much. And you're absolutely right. There's such a vast disparity between spending on children's education in high-income countries versus spending in low-income countries. But the disparity is not just in primary education, and that's the part that I think is really important. It actually starts much earlier in a child's life, in their education and health development. And if we want to maximize this health education link, and we really want to reduce inequalities, we really need to invest much earlier than in the most marginalized children. And I think the statistic that really, really bothers me is that around the world, 175 million children are not even in early childhood education, let alone primary and secondary education. And if we look at what the international community is doing, it's really troubling. If we look at all of the aid agencies, so from the United States to Europe to the Middle East to other donor countries, all of the international financial institutions from the World Bank, Islamic Development Bank, African Development Bank, all of those resources combined, we spend 26 cents per child per year in the poorest countries on early childhood education before they reach the ages of 5 or 6. That's less than 1% of the total education aid budget, but this is when 90% of a child's brain develops. And so it's interesting when we think about, we invest, collectively 40 times more in primary education in high-income countries. If we look at the total collective investment from all of the world's countries and the poorest children, we invest about 20,000 times more in my country, in the United States, in a child before the age of 5 than we do in a child in one of the poorest countries in the world. And the knock-on effects of this are really, really, they come for years and years on end after that. And we know all of these statistics around investing in education really delivers impressive and long-lasting health and education benefits. Every dollar invested in a year of education has a tenfold increase in lowest income countries. A child of an educated parent's much more likely to have access to malaria prevention, other health treatment services. And we know that girls' education saves lives. About 1/3 of the reductions in adult mortality can be attributed simply to gains in girls' education. So when we look at these statistics, and we look at the vast inequities between rich countries and poor countries, what do we need to do to overcome this? What can we practically and tangibly do? And I think that the first thing is invest more money. But we're also up against very difficult times with the global pandemic and the economic outcomes and implications of that. And education is really on the chopping block in so many countries around the world when it comes to their domestic budgets. Revenues are down. There's competition for investment in job creation, infrastructure, the pandemic response in particular. So what do we need to do? The first thing is really, really prioritize education in national budgets. And I think it's so important, from the finance minister to the education minister to the leaders of country, really putting that front and center in stimulus packages and in the recurring budget expenditures. The second thing, which is really related to this report in particular, is co-investment, finding those greater efficiencies when we can invest in health and education at the same time, education and infrastructure investments. And as the COVID vaccine hopefully comes soon, looking at ways that we can really dovetail both of those investments together to get a greater bang for the buck. We need to invest smarter. We need to invest in the youngest and the most marginalized children if we want to reduce inequalities. And then we also need donor countries to really lean in and embrace innovative finance in these difficult times. And there's a new international finance facility for education. And the United Kingdom's one of the donors to this, as is the Netherlands. And it works with all of the multilateral development banks, the World Banks, the regional banks throughout the world, to leverage contributions. And for every dollar a donor puts in, $5 more is invested in countries around the world and their education systems. So we could look at how we could use that to invest more in the early years. It has a tremendous link to health, investing more in primary education, health and education delivery systems. So I think I would encourage every country around the world, if you want to get more for your aid budget, to look into that particular facility. And so I think there's so much that we can do, but again, really to reduce these inequalities, investing early is I think, the main solution we really need to take into account.
Okay, thank you very much. Again, a really interesting assessment. And can I just once again encourage anybody who's listening or watching this to send in your questions? We're getting some through already. And before we go to that Q&A part of this discussion, I'd just like to bring back in Professor Russell Viner as well. By the way, Professor, it's nice to see you've tidied up your shelves from that earlier video.
Thanks. Yeah, I was told to.
They look immaculate now. This is the big question, I suppose, isn't it? We've heard from some of our other panel members there about the importance of the role that school plays in early detection and intervention when it comes to adolescent and child health. I wonder, here's the big question: how do we successfully integrate health and health promotion into education systems? Is there one big thing that needs to happen? Are there a series of things? Is it a cultural? Is it a mindset change? What are we looking at?
Thanks. And I think the key thing is leadership. And I think that's been displayed beautifully today by our speakers. And I want to come back to that. I wanted to start by thanking Her Excellency, Sheikha Hind, for funding this and allowing us to do this work, but also for so beautifully encapsulating the key issue, which is about getting health and education together and having a different vision of what education means, a vision that includes health. So I think it's leadership right from national leaders. And again, I wanted to thank Her Royal Highness, the Countess of Wessex, again, for giving us, this vision of really what can be done. We're using the issue of blindness, but we can see that across so many different areas, and other colleagues as well. I think the key thing is a new vision of education that recognises that education is not just about producing productive workers and producing wealth, but actually producing health and happiness and well-being. I think we can see that. It's very much in the mission of the WHO and other organisations, but we actually need to get that out there. And it's leadership across both health and education that can pull that together. I talked before about it, this idea that schools must be engines of health as well as wealth. Schools already are engines of health to some extent. We just need to tinker. We need to get under the hood and tinker a bit with how schools operate in the most basic ways to help them promote health in a more general sense. We need to get away from the idea that this is health systems or health departments doing things to schools or coming in and parachuting in. We need to actually build our education system with health sort of threaded through it, inevitably, so that we produce citizens, young people that are healthier and have greater well-being. I think that's the key thing. We therefore need to change the language we use. We need to think about the way we train in education and across health. We need to look at health professions that link with schools. We need to look at national policies. Look, this is all in the report. I won't go into it in great detail, but I think it comes right from the top, that integrative leadership. Thank you.
Thank you, Professor. And I should say, if you're just joining us, we are talking about how to integrate health into education in all parts of the world, really. It's a huge subject, and we've got a fantastic group of panelists with us. And do send your questions in. We've got plenty of time to go through them. I'd like to start, if I can, with one question from Tayaba. Thank you very much for sending that in for us. Here's the question. I think we can probably broaden it out a little bit. And Dr. Moeti, if I can ask you to start with your response to this. The question is, what initiatives can developing countries like Pakistan, and I think we can probably broaden that out to other developing countries, can they take in association with more experienced nations to try and integrate health programs into primary education? Dr. Moeti, what do you think? You can start us off on that one.
Okay. I think that clearly there is something to learn. First of all, it is very important to understand, to associate with wealthier countries for what, to what end. So are we seeing in better resourced countries a more effective way of achieving this integration? Or are we looking at an exchange of experiences, strategies, approaches, and solidarity in terms of some of the resourcing that's required to enable lower income countries to be able to benefit? Clearly, if there are ways of carrying out either between countries or between ministries and between different groups and platforms. In the end, I do believe we need to have platforms that are looking at bringing together those who work on health in different dimensions, those who work on education for this mutual benefit, this synergy of learning, including around financing. And I thought our colleagues mapped out very well what could be some of the financing resources that can be available at the international level, so meaning the international banks, regional banks, and part of the aid that is offered between wealthy countries and low-income countries. So I think we can learn in all dimensions, and in the end, sometimes this comes from concrete learning, so making links between different schools, between different regions in countries that are implementing some of this. I think that groups like international NGOs that work in a range of countries, organizations like ourselves in WHO, can also facilitate this linking and sharing of learning, sharing of resources between countries that are better off and those countries that so desperately need both the financing and the ideas. I genuinely think there could be mutual learning. So sometimes countries in the most limited situations as far as resources are concerned can innovate in ways that can inform how these ideas are taken on in the better of countries to be able to have the results that are needed.
Okay, thank you, Dr. Mweti. Your Excellency, can I come to you on that issue? And I suppose the broader point of collaboration and the difference that can make right across the world.
Absolutely. As a small country and in the foundation, we always push for collaboration and partnership, knowing that obviously the impact is so much greater and there's so much that we could learn from different partners around the world. Now, I think with something like education in general, and of course mental health and education, there's a general sense that education for the longest time has kind of gone through the path of one size fits all. And I think with mental health, it's exactly the same. And so partnerships are great and it's wonderful, but we need to always understand that we need to contextualize everything that we do and localize it, especially when it comes to children and mental health. Each need is different. And so I think that as much as partnerships are absolutely important and there's so much that we could learn from each other, it's always important to at least define what are the basic or the foundation for each child and their needs, and then build on that so that we could meet each child's needs separately. I know it's easier said than done, and I completely understand that there are so many resources that have to be put in place for something like that to be actualized. But then if you think about the long-term effect of something like that and what you would be saving down the line, I think it's worth thinking about how could we do it in an efficient way, of course, but one that puts the child at the center of it all. You're muted, Dan.
Apologies. I did the thing that my mum and dad always did. I muted myself. So hopefully I'm back in the room now. Sorry about that. Justin, just to come to you, I've never met anybody who runs a charity who says they couldn't do more with more money. So on that issue of resources, how important is that? If we're going to find some sort of solution or try and find some way, is it about finance?
It's about finance, Dan. I think it's an important point, but it's also about the delivery mechanisms and the leadership in place to make sure the finance is used effectively. Obviously, we always need more money, but I think the important part about this conversation is finding those points of integration between health and education actually allow us to deliver much more efficiently and probably at lower costs. So greater collaboration, cooperation, this notion of integrated leadership, I think is so important, because if we do that and we really focus on the mechanisms of delivering results for children, and I love the point around the context, creating a culture around the context of the needs of children to address mental health and all of the other specialized needs in countries. If we really pay attention to that, how do you get results and hold ourselves accountable? We can make sure that money goes into the system and delivers greater outcomes for young people. And I think that's the most important dimension of all of this. So it's about more money, but it's also about better use of existing resources and better use of new money.
Okay, I think we've lost your picture momentarily. We'll try and get that back for you. But Your Royal Highness, I see you've raised your hand. What was you'd like to add to the discussion?
Thank you. I just wanted to say that one of the most amazing examples that I came across during my travels was with the traveling with Queen Elizabeth Diamond Jubilee Trust and seeing the work that had been done in Malawi. And Malawi, in fairness, doesn't have many opportunities to say that it's been first in something in a successful way. So for them to be able to say that they were in the process and very close to being able to eliminate blinding trachoma was incredible. And it was an amazing example of how government had worked with local agencies and with health and education, and everything had come together. But it wasn't just that they were going to be eliminating blinding trachoma. There were many other areas that were being affected as well. So, for instance, in creating better educational understanding of how to wash hands, wash faces, and be clean around your face, it meant that there were other agencies brought in to allow that to happen. So, of course, they needed fresh water. So WaterAid were brought in to ensure that clean latrines were built. Local populations, communities were taught how to maintain them. And then a number of cases of dysentery and other diseases also were reduced, and indeed infant mortality cases reduced as well. So it's incredible how, if you start with education, if you start, as Her Excellency said, putting the child at the centre of it, it's amazing the ripple effect that happens. And it is just requires sometimes a very simple, basic approach in one area to have this pebble in the pond effect right the way across other health issues as well. I just wanted to sort of elaborate a little bit on how many, particularly across Africa at the moment, many African nations have had a massive impact on other diseases at the same time as eliminating some of the scourges of eye diseases that have been so endemic. Thank you.
Thank you for that. Professor, if I could ask you to pick up on that point, that's the magic, isn't it? If you can show people what works. I saw you smiling along to what Her Royal Highness was saying there. If you can say, look, this is the example, this is how it works, this is the ripple effect, this is what we can do with it, that's the nub of it, isn't it?
Absolutely. Absolutely. And one of the things we've tried to do in this report is put case studies throughout. There's a number of case studies there, some of them from high-income countries, many of them from resource-poor settings, that show how, if you get health and education working together, as Justin said and other colleagues have said, you get economies of scale, you save money, but you also improve outcomes. So hugely important. Thanks.
Okay, I've got a question here about education and health and what we're all going through at the moment, the global pandemic. So I don't know who wants to start on this, but while I ask it, you can make a face at me and I can see which one wants to take it first. Okay, this is from Melanie. At the height of the pandemic, over 1.5 billion children were out of school. Can you comment on the impact that school closures have had on the health and of children and adolescents? I don't know who wants to take that, but maybe Russell, should we start with you and we'll see where the discussion goes from there?
Sure, very happy to start. We've mentioned before that COVID has taught us a lot, and it's sad we had to wait for this. What we have seen is real impacts on mental health. We've got a lot of evidence of that from high-income countries, but we can be absolutely sure that there are similar impacts across all countries. It's interesting. I mean, COVID is an example in so many ways. In the UK here, I've been quite involved in working with government on how we think about the response to COVID and how the overall COVID response has affected children and young people. And I've been incredibly convinced that getting children and young people back to school was the most important thing we could do for their mental health. We could do many other things, but actually reopening schools was a huge part of that. But we also should remember that education and knowledge are our greatest protection against COVID. We saw that with the HIV pandemic. During HIV times, which of course are still with us, but education was referred to as a social vaccine in a sense, that the more educated actually had a much lower risk of catching it because of the impact on knowledge, the impact on behaviours. And again, it illustrates that combination. But I think for COVID, we are clear that for children and young people themselves, the balance of risks is very much about keeping them in school, keeping schools open to promote their long-term well-being. It's a different balance.
Thank you, Professor.
More broadly.
I saw quite a bit of nodding going along with what you were saying there. From Your Royal Highness as well, I saw you, I think you raised your hand at the start. What has been your experience and your understanding of how the pandemic has affected the things we're talking about today?
I think actually on a slightly different front, of course, with schools closing, it's had an enormous impact on children who are suffering other forms of issues in their home place. And that's been a huge problem because, of course, so often school is the place that they can actually reveal to a trusted person that they're experiencing problems at home. And when the schools closed, of course, they often didn't have anywhere to turn to, no one to speak to. And I do worry a lot about the subsequent fallout that we're going to see, behaviours further down the line that haven't been treated. Because they've lost the opportunity to speak out about something that's been going on. It was vital that we reopened schools in order that they had that opportunity to, not least of which, many families in difficult situations, if they have got financial pressures, that they have got the opportunity to get a hot meal in a day. But on the mental health, but also on the physical abuse situation, it's a really I think we're going to see an awful lot of problems coming out of it because we've lost some of the children who weren't able to actually speak to somebody in confidence, and that is a genuine worry.
That's a really good point. Dr. Moiti, I'll come to you in a moment, but I just wanted to go back to Her Excellency. I know wants to come in on this. And there's another question actually speaking specifically about the Qatar perspective on the impact of COVID-19. So Your Excellency, would you like to give us your idea of some of the things you've heard and maybe bring your own thoughts to it as well?
Absolutely. We're actually conducting a study at the moment in some of our schools to look at the impact of COVID. Now, one of the things that we found is that especially teenagers, they've struggled during this time because of when it comes to mental health issues, seeing themselves on the screen has really affected them. And so we've recognized that. But on the flip side of it, there are some students who thrive during this time because they've experienced previously when they were going to school bullying. And so they've managed to now focus on their studies and they've really thrived. So I think both situations show us that there still is a gap. There is a gap in the support that we have in our schools for children who are experiencing mental health issues and just everyday obstacles that come in their way. And so I think it's important that as much as we want to go back to the normal wasn't perfect. And that's something that we have to recognize. And we have to make sure that now that we've had time to really experience both worlds, we need to understand what has worked and what hasn't, and how could we enhance the learning environment for children. And that includes the support that they need, the health support, so they could lead a healthy life.
Okay, I know Justin wants to come in as well. So Dr. Moeti, we'll come to you first on this. You're all waving at me now, it's lovely. And then Justin will come to you after Dr. Moeti. So Dr. Moeti, what would you like to add?
Yes, thank you. No, I wanted to say that what has been documented in Africa, and I think in other settings as well, is an exacerbation of some of the risks, particularly girls run around being in school or not being in school. So an increase in teenage pregnancies, for example, which is linked to some of the risks around sexuality of young girls who would otherwise be safely in school. And one of the big questions being asked is the longer term impact. So will these children be able to go back to school after these gaps? And I believe that girls are particularly at risk, especially if they're from lower income families where the family livelihoods have also been decimated. So to be able to get the girls back in school, if schooling is not free, is going to be a risk. So I think it's very important, working on outbreaks and all the talk about a pandemic might come one day. Well, this pandemic caught us napping, that's for sure, in all sorts of settings. We need to think about how the education sector, the schools, can also be resilient. So what is it that you need to consider? So if a risk like an outbreak is going to make all these billions of children stay at home, what can be put in place, sometimes at not as high a cost as we've needed to spend in responding without having thought about it in advance in designing the education system that will build in this resilience? I think that's some of the things that need to be considered. Thanks.
Justin?
Great, thank you. And along the same lines, when we look at the 1.5 billion young people who have been out of school learning in different environments, some of the estimates show that if we don't get these children back into school and sort of catch up the learning that was lost during this time, the future earnings of these children will be $10 trillion less than otherwise had they been in education. And so the impact that will have on families and communities in the future is really important. And the second point is really around the children who are out of school and did not have any type of access to remote or distance learning. And again, a similar point around girls being the most impacted. There are 24 million children who we think may not ever go back to school, who are already in school before the pandemic. 11 million of them are girls. Child marriage is up, child labor is up, violence against girls in the home is up, mental health quality is down, access to nutrition is down, and all of these have impacts on the future ability to learn. And we all know that the statistics around girls' education, the impact on family and community health. And so restoring safe and inclusive education as soon as possible is really the solution, unlocking big change for this generation of young people. And I think I'm really concerned about sort of this transition back and who are these marginalized populations who may not get that opportunity to be back on track with their learning.
Okay, thank you for sharing that with us. I should just encourage everybody who is watching that we are here for about another 15, 20 minutes or so. So it's a great opportunity to ask questions about this essential topic, not just for the generation that we have talking here, but future generations as well. And we've got a question from Lord Aradasi to Your Excellency. So I'll put this to you if I can, and maybe we could broaden it out from there. The report from Professor Viner highlights that health and education are inextricably linked, says Lord Aradasi. The Qatar Foundation support two flagship initiatives, WISH, which we're part of here, of course, and WISE. Could you tell us, he says, about the latest developments with the World Innovation Summit for Education?
When it comes to what specifically, sorry?
The
or
question
just in
was
general?
About, I think it was more of a general question, actually, yeah.
Lord Darzi likes to put me on the spot. Okay, I'll try to answer the question as best as I can. So with the World Innovation Summit in Education, actually as part of maybe the theme of our discussion today, the past few years, we've been working really hard into integrating a lot of what we do, and with both education and health. And we also have the Family Institute under the foundation. That is our policy arm that looks at policies related to the family as a whole. So it includes the child, but also mothers, fathers, everyone. And so one of the things that we're working on is integrating the three policies together to really have a holistic approach to even policy making. So even when we come up with a policy on children with autism, we look at it not just in the health perspective, but actually what does that mean for them when they go to school? And what does that mean to them even in the family support? And so with the next WISE coming up, we'll see more of that integration and focusing a lot on sustainability and climate change as well now, and the effects on health and education when it comes to that. So hopefully I'm inviting everybody here to WISE 2021. We're hoping it's going to be an in-person summit, but if it's virtual, it will have to be.
Well done. If Lord Darcy put you on the spot there, you dealt with it magnificently. So well done, Your Excellency. Here's a question from Sharon, everybody. And Professor, maybe we'll come to you on this one first. Professor Viner, that is. And this touches on what Her Royal Highness the Countess of Wessex was talking about with regards to mental health. How important is the introduction of mental health into school curriculums? What did your report tell us specifically about that, if that's something that you looked at, obviously?
Absolutely. So introduction of mental health into schools needs to be part of the curriculum, but needs to be much broader than that. Young people themselves these days speak about their mental health in a really very different way to the way people did, when ancients like me were growing up. And there's no doubt that teaching young people about well-being, mental health, and getting them to understand the meaning of that, these ideas of mental health literacy, what helps promote mental health, what's bad for it. These are incredibly important as part of our overall education of young people. But we need to go much beyond that, because I think that's in a sense, the didactic curriculum bit of mental health. And in one sense, I think the evidence tells us that's not as effective as the school culture bits in influencing mental health. What I mean by the school culture bits is how you build a school, how you operate a school, how you run a school. The leadership from the top of those schools, from the headmaster and the teachers, the way that they help set a culture that recognizes the importance of mental health and respects diversity amongst students, and looks at the factors that lead to poor mental health, etc. How the school focuses on bullying, what the school rules are in a sense around bullying. You can actually shift that working with schools if you work with schools and with students. And I think that's really key. So this has got to be not just top down in terms of the curriculum and teaching students, and not just about the leadership from the top, but how the whole school culture is generated from the interactions of students with teachers and the things that are valued in schools. And actually, there's interesting randomized trial evidence. That's the best evidence there is that you can influence this. So this comes from not just high-income countries such as the UK, but also from studies in India and a range of places. So you can shift this. And again, I would just very quickly add, it also needs to be measured, because what gets measured gets done to some extent. And PISA, people are probably aware of PISA, which is one of the great international surveys of how, particularly 15-year-olds, how well they do at maths and English and science, is also starting really to look at well-being and mental health. And actually countries get worked up about that. It influences the way they operate. And that's really important as well. Thank you.
Okay, and unless anybody else wants to come in on mental health particularly, I've got loads of questions to try and get through, and I'm aware that we're running out of time. No one's raised their hand, so here's a really good one that's coming in. Keeping in mind, we talked a little bit about the pandemic, the need for social distancing. Will education systems be transitioning into more out of classroom learning? Dr. Moeti, do you have any thoughts on that? I know predicting what's going to happen in the future in any walk of life at the moment is difficult, but I wonder if you had any insight.
No, I'm just wondering about it. But as I said, I guess building back better will involve thinking about some of these risks of pandemic. I mean, in this case, it's a respiratory virus, so it does demand distance. I think that needs to be considered more broadly. As I said, if you look at Africa, most schools in the lower income countries, especially in rural areas, don't even have toilets, don't have access to running water. So I think you need to look at the package of safety measures that will facilitate the prevention of transmission, and that, in my view, needs to be factored into the design of schools and in the financing of schools, and the linking, therefore, with those who are able to support. But perhaps what's needed is the ability to quickly put in place additional space if it's needed. Because in many countries, to be able to provide schools of the size that will do physical distancing permanently. I mean, in African countries, we have children sitting in classes of 50, 40, just simply to get into school. How to deal with that in a realistic way to give opportunities and to maintain the safety. I think that's part of what the health education interaction could be about in terms of preventing the transmission of disease.
Okay, all the questions are coming flying in now. Here we go. We can try and crack through a few more of these. This one is for Your Excellency, talking about what we've mentioned in terms of resources, coming back to that. It's from Dua saying, while one size fits all isn't ideal, how can a more specialised programs be sustainable in countries with little resources? What sort of advice could you give to her?
Now, I apologize. I think it was Justin who mentioned this earlier about prioritizing states' funds. And I think, to be completely honest, when it comes to education, it's mind-boggling for me that we're not prioritizing it as much as we should. And we think of the short term as opposed to the long term. When you think of crime rates, when you think of the number of people that can get jobs, it's incredible that we're not really focusing on the foundation of it all, which is education. And so, yes, I completely understand it's easier said than done. But I think if we were to prioritize, if we were to spend more on education as opposed to, I will not name any other field as to not to offend anybody, but I think it's important to really prioritize it. And I never fully understood why as a child, I was always told, that education is important and all that, but I never fully understood it until I had my own children and seeing how each child is different. You realize that there is more investment that needs to be made in education so that each child can really fulfill to their potential. And so I don't have the answer. I think each country needs to really reflect and see what their priorities are. But I think more investment in education is the answer.
I admire your diplomacy there, Your Excellency. Very, very impressive. Justin, I know you mentioned this earlier, and I suppose it touches on what Her Excellency was just saying there. Because let's say a government says, OK, we're putting money into education, but we feel that if we sort of promote health promotion and that becomes a priority, then that undermines education. What do you say in response to that?
I think we can do both at the same time, and I think we have to do both at the same time. I was just actually, when Her Highness or Her Excellency was speaking earlier about the issue of mental health, I mean, there are so many reasons why investing in both of these issues, health and education at the same time, yield returns, which then have economic implications. So all of these things actually combine. A dollar invested in mental health in schools and sort of creating that ecosystem that Russell was mentioning yields $11 in return. So $1 mental health culture in schools yields $11 in future earnings of a child. And also thinking about not just health and education, but infrastructure and education, to the question about schooling and distancing and how do we actually return to a normal school. What if infrastructure investments that are being made for commercial uses, for mobile technology, what if we make sure those are education friendly and school friendly? So we're not just, again, building back, but building back better with an education that can integrate new ways of learning. And also, so that they're health-friendly investments in infrastructure in terms of contact tracing, in terms of other interventions. So I think it's not one or the other. It's actually, let's invest more in all of these and actually get greater returns for everybody in the next 10 years. The returns could be astronomical.
Okay, here's a question, which I might need to give a bit of detail for this for people who aren't in the UK. But the question says, some children rely on schools to provide meals that they could not otherwise afford. And the questioner says, as you might have seen from Marcus Rashford's campaign, for those who don't know, Marcus Rashford is a footballer for Manchester United, and his campaign in recent weeks and months in the UK has been to try and get the government here in the UK to fund free school meals. And he's now trying to fund sort of reading in schools as well. Professor Viner, can I put this to you? The question is, COVID has placed many children in a precarious situation, an issue which we've touched on in the last sort of few minutes or so. So how can education systems, the question says, best tackle that issue raised by the fundamental need for food by some of those who are in school, of course?
Absolutely. And I think it's important to say that this issue of school feeding, we can see schools across Africa, across many resource poor settings, have a major role in feeding. And actually, there's really good evidence that feeding children through schools has great benefits for their attainments. What do schools need to do? Schools need to be part of an ecosystem with health and social care and all-round care of the child that thinks about what do we need to help a child learn, and how do we make a child healthy? And that means thinking about the whole background of a child, thinking about the child in the round, and making sure that health and issues like nutrition and mental health are threaded through what the school has to offer. Now, that will require a different approach from education, potentially different training for teachers, and potentially different funding streams. Education can't do it on their own. Thanks.
Thank you, Professor. Here's a question from Edmund, which I think slightly elaborates on something we've been talking about earlier. And again, we know that talking about COVID and the pandemic seems very specific at the moment, but his question is about the role of homeschooling during the current scenario that we're going through. Can the private sector help government to build the infrastructure, says Edmund, to support good homeschooling? Now, that might not be something we need to think about for years to come, but maybe Dr. Moeti, again, I'm sorry to throw this one at you because I know I'm getting the questions as you're hearing the questions first time round. But is that something which we could think about at the moment in terms of private sector support for homeschooling?
Hi. I'm not sure I'm the best placed person to answer this at all. I mean, what I've seen is that the private sector has gotten very involved in the COVID-19 pandemic response in health. And I imagine the private sector has an important role to play in education as well. And if I go back to Africa, it's very clear that we need to think a lot about equity and the involvement of the private sector then. So what sort of child in what sort of family would be able to, with private sector help, unless it is charities and non-governmental organizations, be able to have homeschooling funded privately. So for me, those would be some of the considerations to take. So, but I would say that if we're going to be building resilience into the system, these could be some of the questions to consider. Of course, private investors in education expect to make money out of it. I've seen the private sector get growing very much in countries like South Africa in education. And for now, what I've seen is they've kind of driven inequity, but that's just a personal issue that needs to be considered then in the involvement of the private sector. And I say this, I'm ignorant, I'm kind of struggling with the response. Okay.
You say you're ignorant and you're not sure if you can respond, and then you respond beautifully. So thank you, Doctor. And Justin, I know this is probably a little bit more in your area. So what would you say in support of what Dr. Moeti had just said?
Yeah, no, I think excellent answer, first of all. So you definitely knew what you were speaking about. But at their world, we have the Global Business Coalition for Education as well. And when COVID-19 struck, we had 100 different resources from the private sector that were offered free of charge to education system and parents. And it was everything from devices to connectivity to actual content they could use both in the home and to improve learning in school and distance learning. So there's an appetite there from the private sector to help support and lend these innovations to the education sector. But again, to the earlier point around equity, we need to make sure that when the private sector is investing, that we're also looking at how we're ensuring that it's reaching every single child with equal opportunity, and it's not sort of preferring certain groups that can pay. And so that's where sort of governments and aid agencies can actually make sure that we're looking at the equity dimensions as well. But there's a tremendous eagerness and I think an opportunity to engage the private sector more in the quality of learning with ed tech.
Okay, we've got about 5 or 6 minutes left. What I'm going to do, I was going to ask you a question for you all to think about, and then I'm going to come to a specific question to Her Excellency before we then come back to you all to sort of bring some closing thoughts. This is the question for everyone to think about. During the discussion, we've heard many examples of successful integration of health and education. How do we ensure that we are sharing success stories and learning from each other in terms of what works and maybe more importantly, what doesn't work? And when we were talking yesterday on a panel looking at health around major sporting events, that was a particular area of interest to people learning what to do in the future from what had worked, but what hadn't worked in the past. So I'll try to come to everybody on that as we draw things to a close. But Your Excellency, a question that's coming in specifically for you. The role of the mainstream media, and particularly social media, is very important in improving the general public's awareness of health issues. How important is that to your mind, and have you seen that reflected in Qatar at all?
It's critical, absolutely. I mean, we see that more and more children that are younger are now accessing social media, and I think we still don't understand the long-term impact of something like that is on children at that age. So there has to be a conscious use of social media. I mean, we've seen in recent history how influential social media can be, and just imagine how something like that can get into a mind of the child and what sort of impact it could have. We try to control what our children see or who they're friends with or where they go, but social media has just completely taken those keys away from us. And I think as adults, we need to understand that really the power is in our hands. We also give access to this. And so we shouldn't be passive when it comes to our role with children. And we should know how to use social media in more of the positive, in telling stories. I mean, the question about how do we share stories of our learnings, we know now that with social media, there are no boundaries. But more, I mean, going back to the role of social media, I think it's important for us to educate children on the use of technology. What we did in our schools recently with COVID was actually one of the first week of schools. All the children had to learn what to do in case somebody got into their chat, or if somebody sent them a message that they didn't know. And I think we need to be more conscious about efforts like that in the classroom to educate children. I hope I've answered your question. Can I quickly just answer the question that you asked everybody else?
Yeah, we'll start with you. I'm going to give you all about 30 seconds, if that's okay. So, Your Excellency, if you want to start that one off about, just to remind people about what works and what doesn't work and how we can learn from that.
So I'll just take 5 seconds, and it's a promo for Wish and actually WISE, which is you need to join forums like this. This is where we share stories, this is where we understand from each other, and this is where we meet people like you. So that's my bit.
I should confess, Your Excellency, I didn't set you up to give a promo for Wish, but I suppose it works quite well. Your Royal Highness, can we come to you to sort of closing thoughts on that issue and maybe anything else you'd like to add?
Thank you. Yes, I fully endorse Her Excellency in recommending people to engage with these kinds of platforms and events because you're hearing the best of what works at these events. But I think also, I think more widely and regionally, I think correlating countries in different regions of the world have got a lot to share, because obviously we can't necessarily force a one-size-fits-all to different regions of the world. So again, going back to the example of Malawi and in other sub-Saharan African nations with the issue of blinding trachoma, they've all been speaking to each other. They've seen the examples, and I think example is such a great thing. And if a country next door to you is being able to be effective in one particular way, there's all sorts of different unions that people have and meetings. So I think regionally that's got a large part to play. But I also think when at more government level, where you've got World Health Organization, where you've got the UN, where you've got organizations and governments that can be influential when they're doing business with each other, to perhaps look more closely and perhaps challenge countries to perhaps invest more in their education than they currently are, would be very helpful when people are engaging in having conversations. And I'm trying to say that terribly diplomatically without. So it would be wonderful if in a nice way, people are doing business with other people, that actually education is something that is another conversation to encourage countries when we're looking to be investing, if I can just say that.
You can. Magnificent diplomacy, Your Royal Highness. If I can just give Professor Justin and Dr. Moeti just maybe 5 or 10 seconds each, just so we can finish a roundabout on time. Dr. Moeti, final thoughts.
Okay, thank you. First, to appreciate Her Royal Highness's very diplomatically worded request, and we'll take you up on it to really improve our advocacy. And by the way, I was the country rep in Malawi some years ago for a couple of years, so it's really great to hear about this. No, I think for me, the takeaway is there's such huge potential for this synergistic link to translate in the work that we do in supporting policy right down to implementation and programs. Clearly, there's a lot more we can learn, and I really do like the report that's been published as part of this work, the person-centered start for children. So great, we're going to take it up in WHO in the region, and we're going to come looking for money to implement it starting here. Thank you.
Well done. Justin, very quickly.
Yeah, I think COVID has been a tremendous period of innovation in health education. Some things work and some things will not have worked. And I think with all these channels and ways of sharing, we need to remember to share what didn't work as well, because that's how we learn. I think being able to be honest about failures is a really important piece of this entire experience. And the sun has finally come out in New York. It's morning here. So thank you.
Good morning. And finally, Professor, a final word from you, if we can, and then we'll draw things to a close.
Absolutely. Well, look, sharing success. This is one of the recommendations in the report. We've recommended the establishment of a clearinghouse for sharing learning. And actually, WHO, UNICEF, UNESCO, UN agencies are actually starting to really work together on this during COVID. We need to maintain that and work with WISH. Thank you.
Thank you. And thank you to all of you. I'm sorry we've overrun, but you were so brilliant at the end there. I really wanted to get all your closing comments in. Thank you to Your Excellency. Thank you to Your Royal Highness, to Professor Justin and Dr. Moeti. Thank you to everybody who's listened and hopefully learned as well over the last sort of hour or so. It's been fascinating to get these insights from all over the world. And I think there's something for all of us to take away, and a nice promo for WISH as well. So thank you for watching, and we'll see you all again soon.